Hey YouTube, welcome back to my channel. So this video today is going to be about, or going to be titled, questions or a question to ask your doctor. And the topic idea for this video came from a conversation that I had with a client yesterday, and I thought this needs to be made into a video, so that's what I'm about to do. And I just wanted to mention that I am doing one-on-one coaching. So I have a free 15-minute consultation, 30-minute calls, 60-minute calls, and I offer them at lower rates than other places online. I've also packaged together 4-session packages for those who may want to meet a little bit more regularly, and I offer those at a further discounted rate. I will post the direct link to my online booking calendar in the description of this video, as well as the link to my website if you're interested in checking more out about my bio and my story about psychiatric drug withdrawal and adverse reactions. You can also book sessions through my website as well. And I have long form videos on this channel that detail my whole drug history, my first withdrawal from SSRIs, and then my subsequent withdrawal that was paired with several adverse reactions to more SSRIs, and antipsychotics, benzos, and anticonvulsants. So yeah, feel free to check those videos out if you're interested in learning more about my story in detail. So the topic of this video is a question to ask your doctor. And like I said, it arose from a conversation I was having with a client yesterday. And I see this come up a lot where doctors, obviously there's so much gaslighting in this community. Doctors, a lot of times, it seems like with benzodiazepines, people are constantly getting misdiagnosed as bipolar. But in general, with all of the classes of psych drugs, what I hear over and over again, plus my own experience, was that it's just anxiety, which is absurd. Because if you witness or see someone in active akathisia, dystonia, tardive dyskinesia, I mean, it's far from anxiety. Anxiety is part of it, and terror, but that is secondary to, well, I maybe not secondary, but it's definitely a lot different than your sort of run-of-the-mill anxiety disorder. Even if it's panic disorder, it looks very different. And so I kind of broke this apart, or pulled this apart with a client yesterday who was being told by her doctor or her medical team that it's just anxiety, it's just anxiety. And so the way that I kind of pulled it apart with her and broke it up was, okay, so doctors are positioning themselves as experts when it comes to mental illness, when it comes to psychiatric drugs. They prescribe them so willy-nilly. But my challenge would be to them, okay, if they're telling you that it's just anxiety, then I would ask them, have you ever read the FDA label for any of these drugs? And I'm going to actually go over part of the Klonopin FDA label. And I just chose Klonopin because it's a drug that I coach clients that have been injured from all the time. And it's a benzodiazepine, but I don't think that the other drugs are going to be that much different. So I went through the Klonopin one in detail, and I want to pull apart some of it to go over with you in this video, but I don't think that the other ones would be that much different. I just chose Klonopin. So again, so doctors are positioning themselves as experts, yet psychiatry is not scientific whatsoever. I mean, if you think about, I always relate it back to diabetes, which I've had for almost 26 years now. It's very measurable, it's observable. The insulin doses are dependent on what your blood sugar levels are. Again, it's all measurable, observable, and you adjust doses accordingly. Whereas with psychiatry, it's arbitrary labels, basically created by a panel of psychiatrists who have put together the DSM, so the Diagnostic and Statistical Manual of Mental Disorders. So they basically just decided that we're going to call this group of symptoms this mental illness, and it's observed and diagnosed as clinical when it's happened for this long. Again, it's all arbitrary. It's not measured in some scientific way. They're not doing any type of diagnostic tests. They're just putting this together just to sort of compartmentalize things and to be able to prescribe drugs for the symptoms. So because that's the stance of psychiatry, and I don't know how many clients I've had say to me, my doctor, my psychiatrist will sit me down and say, what drug do you think we should try? And I'm like, it blows my mind that that's even something that a doctor would say, because I just end up responding to the client by saying, why don't they just put these drugs in a vending machine or in one of those gumball machines where you just put a quarter in and turn the thing and whatever pops out, that's what you get. Because that's about how scientific the approach is. And so, again, if you're having adverse reactions or withdrawal reactions, the first thing I would ask the doctor is, have you ever read the FDA label? Because the Klonopin FDA label itself, just Klonopin, that one benzodiazepine, is 49 pages long. And if you go through the first half of it, it talks a lot about like the study trials and the adverse effects. Of course, it has the black box warning on there. And I'm not sure how many people watching this that have been prescribed these drugs. I'm sure a lot of people have been given no informed consent at all, let alone read the label. I don't even remember getting a label. I think legally you have to when you are prescribed these drugs, but I don't remember ever reading it or having access to it. I've read them now, like citalopram, which was my initial drug injury drug, and I think it was like 37 pages. But anyway, so the first thing I would say to my doctor is, have you read the FDA label? And it's interesting because when you read it and they talk about the adverse effects or the adverse reactions and the withdrawal reactions to this drug in particular, it sounds an awful lot like what people describe when they're having withdrawal and adverse reactions, yet the doctor is just generalizing and saying, well, you just have anxiety. So I would say, okay, doc, if you're telling me that I just have anxiety, then I want to tell you, or I want, even if you read the FDA label together, and they still were denying it. I'll get to that actually in a second because I want to go over, I don't know if this would be a trigger warning or not. I don't think so. I feel like people are pretty understanding of what symptoms go along with withdrawal and adverse reactions, but I want to go over what it actually says on the Klonopin label because it breaks it apart into systems. And I'm just going to read the symptoms that they talk about. So it says on here, these are the adverse events that have happened with Klonopin when they were doing trials for Klonopin for panic disorder. So they have it broken up into like seizure disorder and panic disorder, although the symptoms overlap a lot. So just for the sake of this, and because doctors so quickly want to label patients' symptoms as anxiety after they've been harmed by these drugs, I'll just do the panic disorder section. So here's what it says. And the ones on here that I didn't understand what the words were, like the medical terms, I looked them up. So I will break that apart for you guys as well, because I'm assuming other people might not know what these are. So under body as a whole, it says weight increase, accident, weight decrease, wound, edema, fever, shivering, abrasions, ankle edema, edema foot, edema periorbital, injury, malaise, pain, cellulitis, inflammation localized. So that's just for body as a whole. Cardiovascular, it says chest pain and postural hypotension. So a lot of people have POTS-like symptoms, which it says right on the label here. Central and peripheral nervous system disorders, migraine, paresthesia, drunkenness, feelings of enuresis, and enuresis is involuntary urination. Paresis, which is muscle weakness, tremor, burning skin, falling, head fullness, hoarseness, hyperactivity, hypoesthesia, which is numbness, tongue thick and twitching. Under gastrointestinal, it says abdominal discomfort, gastrointestinal inflammation, stomach upset, toothache, flatulence, pyrosis, which is heartburn, saliva increased, tooth disorder, bowel movements frequent, pain, pelvic, dyspepsia, which is upset stomach, and hemorrhoids. Hearing and vestibular disorders, vertigo, otitis, which is ear infection, earache, motion sickness, heart rate and rhythm disorders, palpitation, metabolic and nutritional disorders, thirst and gout, musculoskeletal system disorders, back pain, fracture traumatic, sprains and strains, pain leg, pain nape, cramps muscle. I don't know why it lists it almost backwards. I'm not sure why. Cramps leg, pain ankle, pain shoulder, tendinitis, arthralgia, which is joint pain, hypertonia, which is high muscle tension, lumbago, which is low back pain, pain feet, pain jaw, pain knee, swelling knee. Platelet bleeding and clotting disorders, it says bleeding dermal, which I believe dermal means skin. Psychiatric disorders, insomnia, organic disinhibition, anxiety, depersonalization, excessive dreaming, libido loss, appetite increased, libido increased, reactions decreased, aggressive reactions, apathy, attention lack, excitement, feeling mad, hunger abnormal, illusion, nightmares, sleep disorder, SI, yawning. Reproductive disorders, female. Breast pain, menstrual irregularity. Reproductive disorders, male. Ejaculation decreased. Resistance mechanism disorders. Infection mycotic, which is fungal. Infection viral, infection streptococcal, herpes simplex infection, infectious mononucleosis, and monoliasis, which is, did I put that on here? Sorry, I think I missed that one. I think that was, yeah, I'm not sure. I can't remember. Respiratory system disorders, sneezing excessive, asthmatic attack, dyspnea, which is shortness of breath, nosebleed, pneumonia, and pleurisy. Skin and appendage disorders, acne flare, alopecia, which is like losing your hair, xeroderma, which is, sorry, I think I missed that one as well. I think I couldn't find the proper description for that one. Dermatitis, contact, flushing, pruritus, which is itchy skin, pustular reaction, skin burns, and skin disorder. Special senses, special senses other, taste loss. Urinary system disorders. So dysuria, which is painful urination, cystitis, polyuria, which is large volumes of urine, urinary incontinence, bladder dysfunction, urinary retention, urinary tract bleeding, urine discoloration, vascular disorders, thrombophlebitis, leg, vision disorders, eye irritation, visual disturbances, diplopia, which is double vision, eye twitching, styes, visual field defect, and xerophthalmia, which is an eye disorder from vitamin A deficiency. So as you can see, it's like a huge long list of symptoms, and there's even, a section in there with psychiatric disorders, which includes anxiety, which includes DPDR, which includes SI. And so I challenge the doctor, again, like I said, have you read the FDA label? You haven't? Let's read it together. Okay, so if you're saying that my symptoms are from organic mental illness, I just have generalized anxiety disorder, I just have major depressive disorder, I just have DPDR, like this organic illness, then I want you to prove to me, based on, your science and, you're a doctor, you're trained in the scientific field, prove to me that my symptoms are from these organic disorders and not because of these adverse reaction lists directly on the Klonopin label, because they're not going to be able to do that. There's no test, there's no diagnostic whatever, there's nothing, there's no scan, there's no brain scan to determine what's going on with any of these reactions. And so because it's listed right on here, they would have to acknowledge that it could be from it, because it's literally listed here. And again, you can't siphon, there's nothing they can test for objectively that proves whether or not it's from the drug or it's an organic illness. And so I just want to empower people with that. And I didn't have that information when I was experiencing my adverse reactions and withdrawal. There's a whole section on the withdrawal as well. And in my experience, as coaching people, these types of, even though it lists them as adverse effects, is the same type of symptoms that people get when they come off the drug. And they talk about that on the label, but it's just not, they don't break it down in the exact same way that they do with the adverse effects. So I just want to say, like, for those of you who are getting gaslit and being told by your medical professionals, your family, your friends, that you just need help, you just have anxiety, you just have psychosis, whatever it is, and you need help for it, I would show them these FDA labels and say, like, it's acknowledged by the Food and Drug Administration themselves. And again, there's no way for them to test whether or not what you're experiencing is in your head, or I don't even like to use that term, or like an organic mental disorder, as opposed to a direct drug effect. So I wanted to say that, and I wanted to say that, like, I validate you, I understand and totally believe everything that you guys are going through, because pretty much everybody that I talked to did not have symptoms or like mental problems before they went on these drugs, which is, I don't know if you'd say ironic, because these are mental illness drugs. I mean, some people had some issues before, even myself, but they were not impeding on their functioning. They ended up going on the drug a lot of the time for life stress. They had a stressful job, they had a stressful living situation, they had some type of loss, so, grief, death. It's usually something like that, that I hear from the majority of people. And then they were irresponsibly prescribed these drugs, given no informed consent, and then gaslit when they're having reactions and or withdrawal symptoms. So I just want to say, like, everything that you're experiencing is an absolute real effect from the drugs. And again, like I talk to so many people that say that they never had any problems before these drugs. They were just given them for life circumstances. I got prescribed them for job layoff. Like I did not have mental illness at all. And, and people are kept on them for years or decades for a life situation. Even if they were prescribed irresponsibly for a life situation, they should then be taken off them when that life situation has subsided. Like in my case, I ended up getting my job, or my old job back, actually, the one I got laid off from that I loved, a couple of months later. So I should have then been taken off the drug, but I wasn't, because the doctor at the beginning of every visit, just like for my diabetes or whatever, would say, how's the mood, how you doing? And I would just be like, I feel fine. And then rather than being like, let's explore coming off since you are doing well and your life is going well and you don't need them anymore, even though I never needed them, let's discuss coming off. It's just like, okay, you feel fine, so the drugs are working, let's keep you on them. And this is just what ends up putting people on these drugs for so long. And I mean, the Klonopin trials, the longest one that it says on the FDA label that they did testing of this drug for was 6 months, and they weren't even tested on it wasn't even tested on certain populations at all. And so it's extremely alarming, and I just wanted to again pull that apart for you. And I would challenge, like, if you have a doctor who is telling you these things and you have to have continued relationship with that doctor for whatever reason to continue your prescription, if you're tapering or whatever it might be, I would challenge them with that. I mean, they'd have to respond somehow. I mean, I'm not sure if you guys have tried this approach before. If you have or haven't, or if you've read the entire label of your drug, let me know in the comments and what your experience has been if you have confronted your doctor in this way. I would love to hear, because I just was unaware completely when I was going through my process, until I was much further down the road and I realized what was happening. So anyway, I hope you guys are doing well, and I hope if you celebrate Easter, I hope you have an okay Easter weekend and you're able to, I know it's always relative, but like enjoy it as much as you possibly can if you have family plans or whatever. Just take care of yourselves, and I'll see you next time. Bye.